Tonight's first bedtime lesson is about wisdom tooth removal. Wisdom tooth removal is where one or more wisdom teeth at the back of your mouth are removed or extracted because they're causing problems. Now, why does wisdom teeth might need to be removed? Wisdom teeth develop later than other teeth. They usually start coming through into your mouth in your teens or early 20s, but they can cause any problems at any age. You may need to have wisdom teeth removed if they do not have enough space to come through into your mouth fully. For example, they may be blocked by another tooth or impacted, or partly covered by your gums. This can cause pain and swelling, infections in your gums, food getting stuck, tooth decay, gum disease, a buildup of fluid around the tooth, and a dental abscess. A dentist may do x-rays to check how your wisdom teeth are positioned. If it's not causing problems, the tooth will usually be left where it is and monitored at your routine dental checkups. Now, what happens during wisdom tooth removal? Now, a dentist might be able to remove a wisdom teeth, or they may refer you to a specialist at a hospital, clinic, or another dental surgery. You usually have a local anesthetic injection to numb the gum, so you will not feel any pain. You may also have sedation to help you feel relaxed, or you may have a general anesthetic where you're put to sleep. You'll only need these if the teeth are more difficult to remove or you're anxious. The main steps to remove them are: the dentist or surgeon will cut your gum if it's covering the tooth. They'll widen the socket where the tooth fits into your gum. The tooth will be removed in one piece or cut into 2 or 3 pieces. Your gum is then stitched if necessary, using dissolvable stitches. It often takes just a few minutes and should take no more longer than 40 minutes. You'll usually go home the same day. If you've had a general anesthetic, you may need to stay in hospital overnight. Recovering from a wisdom tooth removal. But first, here's a surprise. It's midnight. So do you know what that means? Happy June! Welcome, June! Yes, like I said, welcome into June. Welcome... What am I saying? We are now in the month of June, finally. We're already halfway through the year already. So that was quick, wasn't it? But anyway, let's get back to the lesson. Recovering from wisdom tooth removal. You can usually go back to your normal activities the day after you've had your wisdom tooth removed. If they were more difficult to remove or you've had a general anesthetic, you may need to take 1 to 3 days off work. For up to 2 weeks of having wisdom tooth removed, you'll usually have some pain and swelling, which should start to improve after 1 or 2 days. You may have bruising on your cheek. Your jaw may be sore and stiff. You may find chewing and swallowing uncomfortable. If you had stitches, they'll dissolve by themselves. 1 second. Oh yeah, 1 second, I'll do a command now. Hey Siri, low power mode off. Really? Honestly. Hey Siri, low power mode off.
Okay, I've turned low power mode off.
Anyway, you'll usually have some pain and some swelling. If you had stitches, they'll dissolve by themselves. A blood clot will form over the wound, which helps it to heal. You'll be given advice about things to do for the first few days to help your recovery. Here are the do's and don'ts. Do's. Take paracetamol or ibuprofen to help with pain. Eat soft or liquid food until you can chew more comfortably. Keep the wound clean by rinsing gently with mouthwash or warm salt water. Clean your other teeth carefully, avoiding the affected areas so you do not damage your stitches or the blood clot over the wound. If you get bleeding, press the area for at least 10 minutes with a clean cloth or piece of cotton wool. Here are the don'ts. Do not try for 48 hours after a general anesthetic or for 24 hours after a sedative injection. Do not eat hard or crunchy food. or food that you could get stuck in the wound, such as nuts and seeds. Do not smoke. Smoking can increase the risk of infection. Do not drink alcohol or very hot drinks to reduce the risk of bleeding and scalding. Possible complications. Wisdom tooth removal is usually a simple procedure, but as with any procedure, complications can happen. Your dentist or surgeon will explain the risks to you before the procedure. Complications can include a dry socket, which means a painful condition where the blood clot over the tooth socket does not form properly or is dislodged before your gum has healed. An infection, which may need to be treated with antibiotics. Damage to nerves or close to the tooth, causing numbness or tingling in your tongue, lips and chin. This usually gets better but can last a few weeks or months. Time for our second bedtime lesson.